All right, we're going to talk about the knee. This is something I've been trying to educate people on for a few years now, actually, a number of years now. So, I'm designing a protocol, regenerative protocol for a young athlete, early 20s, had a bad accident with his knee, tore his ACL. And in the MRI report, it mentions notes the torn ACL, but it also notes that there's an area of chondromalacia. Now, that's a diagnosis where the cartilage over the bone, this nice glistening, smooth cartilage that's supposed to be there, that protects your bone with impact, was wearing away. And in this case, was worn away. This was actually bare. There was didn't say the size of the defect, but with trauma that is significant enough to tear an ACL, which is so strong. This is such an incredibly strong ligament. When that happens, if this is your femur and this is your tibia, when that ACL tears, there's oftentimes a bone-on-bone impact between the femur and the tibia that makes it such that the cartilage gets damaged. And for years, I have been explaining to folks, this needs to be addressed. So whether or not you get your ACL reconstructed, you need to address this cartilage damage. And sometimes there's cartilage loss. It's gone. Now, unfortunately, this gets glossed over a lot of times. There are certain orthopedic surgeons or technicians that will address this. And they have techniques where they will try to reseed and encourage the growth of cartilage in these denuded or stripped or bare areas. But for the most part, if you have an ACL injury like that, it's the ACL that gets repaired, and good luck. The problem that I have with this is you just signed yourself up for a potential knee replacement in about 15 to 25 years. And no one told you that you've got this smoldering fire. It's not a raging fire, it's just smoldering, that is creating this inflammatory state within your knee. There's all of these cytokines, these signals with this inflammation that is slowly destroying the knee. There's degeneration. We call it DJD, degenerative joint disease. It's a process. It starts somewhere. And this can be either arrested, so you hit a plateau, and ideally improved upon with regenerative techniques. So if you have had a knee injury, please go back, look at your MRI report, and see if there's a comment on the cartilage and the meniscus. Oftentimes there will be a meniscal tear. What I'm talking about is the glistening cartilage that covers the bone, not the meniscus. If you do have, and the diagnosis is going to be chondromalacia. If you have that and it wasn't addressed, this is where you need to do some kind of intervention in order to try to help that area not grow, not get greater, because you want to preserve that as much as possible so that you don't end up in a situation where you have bone-on-bone arthritis, okay? So again, the evidence is there. The comments are oftentimes made. The problem is who can address it? What tools does the doctor you are seeing, what tools do they have in their toolbox? If they only have a knife, everything they see, they want to cut. I have no interest in you being cut upon. If it's the best thing for you and the best thing for your goals, I will support you and I will help you recover the best you can afterwards. I will prepare you for the surgery so that you get the best outcomes. But if that's not something that you need, surgery is the last resort. Once your knee is cut upon, your knee is forever changed. You cannot control how you heal. There's different risk when it comes to infection. There's risk with the anesthesia. But if you do have a defect like that in the cartilage, if you do have other issues with your knee after you've had surgery, regenerative medicine, regenerative techniques, that's what you need. That's what's going to help you get back or resolve this new pain that you have after the surgery, or the existing pain that the surgery didn't take care of. If you had an excellent surgery, everything's going fine, you're doing exactly what you want, then good for you. You had a good surgeon, you had a great outcome. But I see people that tend to have issues afterwards, or they don't want surgery. And so I am supportive of those folks and I help them get good outcomes. Okay? So if you have any questions, please comment. I'd like you to like, subscribe, and please share this with anyone that you know who has a knee issue, ankle, low back, hip. If it's a joint, I can help you. Okay, take care. Bye-bye.